Hi, good morning, everybody. I'm so happy to see all my friends from Hawaii, from Hong Kong, from Philippines, and from Singapore, Australia, New Zealand, Los Angeles, also from Canada. Wow, that's a lot of good people. Actually seeing very many different people. And I want to wish you Happy New Year and good health, and also prosperity in 2022. We are definitely will have an exciting new year, and learning more about how to control diabetes could be even help you to be getting your health straightened out, and you can be healthy. That will be super good. And I appreciate you actually spending your valuable time learning about diabetic management, and this is going to be really wonderful. And certainly, reason why I make this webinar is because there are a lot of people actually came back and said, "Hey, I've been pre-diabetic for a while. Should I maintain the same regime, everything? Do I get well?" Actually, a lot of people have asked the same question, and so I thought that would be a good time to kind of understand. Actually, if you are pre-diabetic and diabetes, as time goes on, your disease will be progressed. If you gotta basically need to end up to either have better control or change the regime to adjust to help you. I'll share you a lot more story later on. Some of my friend who has been, treating themselves very well, and as time goes on, they thought that they are really getting well, and net result, you know what? They start losing some of the seriousness to control. So end up their blood sugar start going back up again and again and again. And that result, they didn't know, and they kind of shocked them and said, "Oh my goodness, how come? My blood sugar got up tremendously." So these are the kind of things that I thought perhaps we can able to help you to basically have better understanding. Hi，各位堂友，我係 Angela 啊，LOWSUTEA President，多謝你今日咁忙嘅時間都嚟聽下我哋講座。首先我恭祝你咧身體健康，同埋咧能夠喺2022年咧能夠減低你血糖，能夠繼續身體健康，能夠好舒服咁過到呢個2022年，同埋咧就能夠更加咧係幫助你咧，幫你能夠希望將你個血糖降到更加低咧，就 below 呢個 A1C 6.4以下，咁就最好啦。OK， so hope everybody's here now. I saw a lot of wonderful people joining us. So I'm going to start my webinar today now. Let me share with you why I want to have this webinar to be started. And there are so many people asking, well, I've been diabetic for a while. Do I need to have a change of my regime? When I getting, blood sugar will be always well controlled. And but I found that majority of the situation is not the same. Unfortunately, when you have diabetic, you really have to continue to manage it. And that's why a lot of people in our program, they love it, because we don't just talk about diet. The majority, the worldwide program I saw many places down in Hong Kong, but even in USA and so forth, they talk about mainly a lot of time is diet or very focused on one item, but not talk about total management. In our program, we hope we can able to provide you a total management scheme so you have better control. And that's what we're trying to do. And we have a heart and passion to really, you got that education, you can understand what to do to lower your blood sugar, not only, but how do you maintain that? Now, as we move on, unfortunately, we tend to be maybe at times slacking off, including myself, because I start seeing myself sometimes that I'm so comfortable. A1C was 6 now. Maybe I can eat 3 ice cream. Wrong. You cannot do 3 ice cream because your A1C is 6. So you really have to continue to really motivate yourself, learn about all the mechanism, not only diet, but exercise, control your weight, and also continue to measure your blood sugar. Man, with all that, you will able to actually, and on top of that, with all the webinar, I start saying, wow, I really have to motivate myself to continue to manage and in order to keep myself healthy. And when I talked to my doctor, the doctor said, wow, you are doing really well because your A1C was 6.9, dropped down to 6. And that is truly an achievement. And the funny thing is, many of my patients, the A1C was 10 and they dropped down to 5.7. They're beating me. Wow, I said, my goodness, they're so good. So I realized we need to continue to help each other to motivate, to learn, to control your blood sugar. And that is what you're going to do. So, but I have a lot of new people coming in right now. So I will have to just go through real good in about 5 minutes. I'll tell you, just catch up what is diabetes so everybody know. And then with that, we'll move on to our lecture. Now, everybody understand diabetes, you don't get well. It's a chronic disease. Only thing you can do is control. To control you basically, because the reason is diabetic will affect entire body. You didn't listen wrong. It affects all your vessels. It plugged up all the after. Later I will show you why it plugged up all the vessels. The only way you can prevent and control your diabetes complication is by diet, exercise, weight control, and so forth to help you. And you pre-diabetic is the same thing. You really got to continue to do that. And you have to drive your A1C down to 6.4. If you don't drive your A1C down to 6.4, you are still at risk to continue to plug up everything. And so proper dieting, weight loss, those are the key element to help you, so you can get rid of all the white powder food, meaning like rice, bread, and so forth, and soda, all those guys, and start to drink LOWSUTEA will definitely help you to lower your blood sugar. 嗱，各位朋友，因為今日咧好多朋友係新嚟㗎啦，咁要知道咧，原來糖尿病係永遠唔好嘅，只係能夠控制。咁點控制啊？就一定要咧，其實要運動啦、食材啦，同埋減肥啦。咁同埋咧，你亦都要繼續嘅，成世都係咁㗎啦。咁你就一定要係繼續係做呢啲咁嘅嘢啦，係聽書啦，同埋度你血糖。因為你唔度你血糖，你係唔知道你個血糖嘅情況係點嘅。咁當然啦，飯啊，嗰啲叫白粉啦，可以講為麵包啊，呢啲 flour 都係白粉嚟㗎嘛。咁你就要戒咗佢啦，或者食好少。咁同埋咧汽水嗰啲就唔飲得啦。咁當然啦，去糖就一定會有幫助嘅。This is a very important slide. I would like to repeat over again. Hopefully everyone remember. Because when you start diabetes, is actually 4 stages. The first stage is your LDL go up, and majority of people you can see, all your friends talk to, the cholesterol goes up, and then will damage the B cells. B cells, pancreas, the cells come from the pancreas to take sugar into the cells. And when B cells are damaged, more and more B cell damage, the sugar, the insulin is not going to work. So your blood sugar go up. When blood sugar go up plus cholesterol together, the blood becomes thick. You go second stage, because when it's thick, it forms all kind of plaques and go everywhere in your body, entire body, from eye, brain, heart, everything. So net result, your blood pressure will continue to go up. Now, if you don't do anything, you don't control it, you know what? Then you go to stage 3 because your blood sugar is going to go up. Then you become, with the A1C, will start moving up from 5.7 to 6.4. And when the stage 4 is anything over 6.4, you become a diabetes. Now, everybody goes through this stage. If you want to take a picture, you can take a picture of this, because really, this is something you really have to know. So you know the reason why diabetes is so not good for everybody, because of this plaque. This plaque here is plug your brain, it plug your heart, it plug your kidney, it damaged, and you will continue to suffer because of that. And that is the most dangerous stuff. Besides all the consequences due to the plaque throughout your body. Okay. 各位朋友，其實呢個咧係最重要嘅4部曲。第一部曲係咩啊？就係你個 LDL 嘅膽固醇上去。咁當你上去嘅時候咧，佢就 damage 咗，即係將嗰啲叫胰島素出嚟嘅 B cell 破壞。當佢破壞胰島素 B cell 就帶啲糖入去細胞，冇咗一樣嘢咧，啲糖繼續升上去嘅。咁糖同埋 cholesterol 繼續高嘅時候咧，咁咧第2步上嚟咧就係你個膽固醇 同埋你嘅糖就好結啦，令到血咁咧就會令到你血壓會上升，因為佢 form 咗好多血呢啲咁嘅板塊喺度 plaque 啊，成身都係喎 ，OK？ 咁如果係咁咧，你血壓就可以上高噶啦。咁上高之後你咩都唔做嘅時候咧，咁你落去咧3年裏邊咧，你血液嘅 A1C 就可以上去咯喎，咁就由5.7一路上到6.4，過咗到第4部曲咧就係你糖尿病啦。嗱，once過咗糖尿病咧就唔翻轉頭嘅。咁呢個咧係一個好重要，你可以影張相喺度啊，因為呢個咧就係呢個4部曲，個個人都高豬樣嘢嘅，所以咧我都希望咧大家了解點解糖尿病係一個好大問題，因為呢啲咁嘅板塊喺血管啊，全身都係，咁令到你係有好多問題嘅。嗱，點解血糖係 work 咧？就第一，因為咧我哋有個叫做番石榴裂啦，就 delay 咗啲糖 absorb 去個血管裏邊啦，喺個大腸去血管係 delay 咗佢啦，咁咪吹唔到就掉咗喺嗰個糞便走出嚟啦。咁然後咧就beta melon咧就可以帶啲糖咧，好似胰島素咁帶糖喺細胞裏邊啦。然後咧就亦都帶啲糖咧，同埋個鹽咧，同埋個 cholesterol 喺個尿道走出嚟。咁變咗嚟講咧，你就能夠降低血糖 cholesterol。同埋鹽降低鹽之後咧，你血壓就會降低㗎啦。OK， now how LOWSUTEA works very simple. There are 2 items in there. One is guava leaves that act like actually it blocks sugar into the cells. Actually delay the absorption of the sugar, so you really get off the sugar from the gut, get it out from the fecal matters, and then your beta melon basically act like insulin, takes sugar into the cells. It's like an insulin booster. On top of that, beta melon has another thing that's really good. It dumps sugar and cholesterol and salt out to urine. And that result, when the salt go down, then you will lower the blood pressure. Also, one more thing is also detox. So that's why this is a very simple, good tasting tea, but it has magical really effect to your blood sugar, cholesterol, and blood pressure. Now, if you don't do anything, what's going to happen? The consequences is big, because what happened is diabetic, you're going to have risk of stroke, you have risk of the cataract, glaucoma, blindness. That's one thing. That's really sad. It will screw up your pancreas function, so insulin doesn't come out anymore. You have the insulin rejection. 40-60% of a diabetic patient will get heart disease. Bypass and heart attack is very common. Nerve damage, you can't feel. It's really sad. Besides, you lose your memory, but you can't feel. So net result, you can't feel, you know what? You have sexual dysfunction. You can't feel, right? And high blood pressure is also very common and damage your blood vessel. And you can't feel, you injure, you get infected, you amputate your foot because circulation also very poor, it damages your kidney and you need dialysis. Plus, people who are pregnant have gestation diabetic, they will actually end up will be a diabetic patient sometime down the road. So all that is your risk you have to take care. So you can't take this lightly because this is a lot of people who are diabetic. This is the complications that you are potentially will be facing. 嗱，各位堂友，你咩都唔做嘅時候咧，有個好大問題咧，就係你會有 end up 會中風啦、青光眼啦，同埋你個胰臟有損壞啦。40至60病人咧會有心臟病嘅，同埋有神經嘅損毀啦，同埋個 blood pressure 上去啦。要割咗個腳咧，如果啲嘢唔好，即係損毀之後唔好咧，咁你可能要 end up 割咗個腳嘅。咁同埋咧，仲有咧糖尿病啦，好多係損壞咗個腎啊，咁腎咧就要洗腎啦。咁同埋好多人因為冇咗 feel 咧，咁佢哋就冇呢個性功能嘅障礙啦。咁同埋咧，仲有咧就係好多如果有呢個懷孕併發症咧，佢將來真係會變咗糖尿病者嘅，咁呢啲要注視啦。咁我哋公司咧好特別嘅，就第一，我哋有5個 program 幫你嘅。第一有個 diet 嘅 program 啦，教你點樣食嘢啊，同埋飲虛糖茶啊，有 exercise 啊，咁同埋咧就點去控制你磅數啊，同埋聽我哋講 webinar 同埋點樣度血咧。咁我哋希望咧，其實做呢啲嘢咧係幫助你由 A1C 咧降到5.7。咁當你有咗呢樣嘢之後咧，你仲有啲血管啊唔會損壞啦，能夠令到你咧係繼續係一個健康生活。Okay, our objective is very simple. We have a proven 5 program helping pre-diabetic, diabetic patients to lower their blood sugar by dieting, drinking LOWSUTEA. We'll do also exercise, how to exercise, help them to learn about what exercise you need to do to lower, to burn up the excess sugar, and also weight control with BMI under 23. We every week have weekly webinar you can hear and learn, and then we have blood tracking, so you can able to understand where you're at, what to track, and so forth. And what our objective is, hopefully your A1C will drop down from 10% and above to go down to 5.7, and that's our goal. So you can have a healthy blood sugar level, so you don't have all the body damage as we just talked about. So today we are going to basically talk about our type 2 diabetic is a really long-term disease, but you will have to change as we move on. So this is a very good topic to sort of alert you. You cannot live throughout the life the same old. It doesn't work that way. Now, first of all, when you're a pre-diabetic patient, because of long-term disease, well, it really requires you to adjust as time passes, because there are several factors you need adjustment. We'll talk all about it. Even though you work really hard to say, I'm controlling my disease, but as time goes on, your condition will change. It could be age, could be whatever, and could be your disease or your organs start getting getting old. So you can really need to adjust your diabetic management plan to make sure that you continue to be healthy. So really, we start going through this. You're going to start learning, okay, what is the major things that you need to watch? First, your pancreas. Is your pancreas, which is a very important organ to increase your insulin, right? To give you insulin to take the sugar into the cell. So is it really produce enough insulin or not? If not, then how can you get more insulin? Well, probably you might have to insulin injection, or or you have so much glucose or blood sugar in the bloodstream. Well, how are you going to drive it down? So these are the things that you will need to consider and working with your doctor, and also possibly drinking LOWSUTEA to help you lower your blood sugar. So that's why we thought that perhaps we need to talk about that today, give you more alertness so you know what's going to happen, so you can start learning, preventing, planning for it. And this is a total diabetic management. 嗱，各位堂友，前期患病者同糖尿病病者，你要知道咧，呢個係一個一世嘅疾病嚟嘅，就唔係好嘅。但係你知咧，一路行嘅時候咧，你會繼續轉變啊。咁呢個轉變咧，其實咧你係要開始計劃話點變咧。咁其實咧，就算好多人就話，哇，我好已經好責任心好重，能夠控制血糖啊，但係點解血糖都係繼續高嘅？咁好多時咧，因為當你老一啲嘅時候，你可能嘅身體轉變啦，人嘅轉變嘅所有嘅不同嘅胰臟啊，都會轉變啦。咁呢個係會影響到你整體嘅糖尿病嘅控制嘅。咁同埋咧，你真係要知道，喂，我哋個胰臟係行緊 work 㗎，依家。如果唔夠胰島素點樣啊？咁如果啲細胞又唔聽話，唔將啲胰島素唔識帶啲糖入去個細胞係點樣啊？咁同埋個血糖繼續高係點樣啊？嗱，依啲咧全部都要知道點去控制啦。有陣時咧，醫生咧就淨叫你食，好多糖友就話我醫生繼續呢樣我食咁鬼高，但係我啲糖唔跌嚟嘅。咁可能因為你嘅生活要習慣改變啦，或者亦都要飲去糖茶啦。嗱，呢個我要講遲啲咧，你會知道咧，原來飲去糖好緊要嘅。所以好多病人咧，其實佢話：哇，醫生繼續食藥，但係糖唔跌嚟，但係飲咗去糖茶咧 ，guess what？ 啲糖會繼續降低嘅。但係咧，所以呢啲係要繼續努力，大家一齊去合作。OK， so really at the end of the day, when we talk about our ongoing progress to diabetes, really you need to figure what need to be adjustment. So let's talk about that. Now, as I mentioned just now, your pancreas are continue working, but sometime as you go on, it doesn't respond anymore. The insulin, although come out a lot, but you are not getting the sugar into the cell. And that result of that, a lot of times this is called insulin resistance, okay? Although your pancreas is hard working, pumping a lot of insulin out, but the cell does not respond because of insulin resistance. So eventually, the pancreas, even to come out a lot of sugar, but because you don't have enough insulin, or the insulin doesn't work anymore as a resistant, then your blood sugar will continue to go up. Net result of that will get so much in our bloodstream, and a lot of pre-diabetic patients, because of that, they become type 2 diabetic. Now, a lot of times it's not because it's medication, lower your blood sugar, but a lot of times because you have so much sugar in there. So how you lower it? And sometimes you might need some booster, like LOWSUTEA can help you. So it's very interesting. I'll share with you more story about that. But more important, first thing you have to look at is really insulin. Is it enough insulin for you? And if is it because a lot is resistant? A lot of time, most like a diabetic patient, you have insulin resistant. That's why you need that additional booster to help you bring the sugar into the cell. 嗱，各位堂友，其實好多人咧，第一你知唔知道？喂，胰島素好多出嚟，但係點解唔夠用嘅？個原因咧就係因為咧你有個胰島素抗拒。嗱，可能呢個胰島素抗拒咧就係因為你嗰啲呢個膽固醇LDL 咧係破壞晒嗰啲 B cell， 咁破壞咗 B cell 越出嚟多，佢都做唔入到去嗰個入唔到去個細胞裏面咧，所以變咗咧佢咧就係有個所謂叫胰島素抗拒。咁就算 pancreas 出好多胰島素咧，即係胰臟出去你都做唔到嘅。咁但係你可能就要需要一啲東西咧係有個 booster 帶佢入去，所以變咗嚟講咧喺血糖就係可能會有幫手，係帶到啲你啲糖咧入翻去細胞嗰度啊。咁但係當你做唔到呢樣嘅時候咧，個問題就好大㗎咯喎。If you cannot bring the sugar into the cells, then the problem will come a lot worse. The reason is because your blood sugar continue to go up, and the blood sugar is very high. Then you have all the problems like risk of stroke, cataract, cannot see, blindness, heart disease, your pancreas no longer function anymore, nerve damage, high blood pressure, amputation, diabetic nephropathy, also no sex, the sexual dysfunction, and you're pregnant. Eventually, you have high blood sugar. Even get well later on, you can develop diabetes. So all that will come along. 嗱，各位同學，如果你啲糖控制咧，其實呢個咧係會繼續會有好多損壞嘅，即係中風啦、青光眼啦、個胰臟唔 work 啦，或者你心臟問題，呢個最幾大問題嘅心臟病，40%至60%病人咧係有心臟病嘅，同埋仲有咧有神經系統損毀啦，咁你冇 feel 啊，呢個弊啊，咁同埋唔記得嘢又係好弊嘅，你會唔記得嘢或者你 keep 即係好多老婆婆咧成日問，哇你食咗飯未？想問好多次，個原因就係呢啲糖塞咗個腦度，記唔到嘢，啲 nerve damage 咗。咁仲有血壓高咧，同埋如果你整親個唔好咧，你割咗個腳去咧，呢個好慘啦。咁同埋咧，仲有洗腎啦，同埋好多時咧，因為佢冇感覺咧，咁你就性能都有個性功能都有障礙啦。咁同埋如果你係有pregnancy 嘅，有個 gestation diabetic 嘅，將來可能真係好高機會咧變咗有糖尿病嘅。So, what type of change it will be occur if you are, diabetic and you go on? Now, really, at the end of the day, one medication will definitely adjust over time. Now, unfortunately, in medicine, doctor will basically just say, "Well, if your blood sugar go up, I'll give you more medication, more medication, more medication." And a lot of patients would say, "Hey, man, I used to have 500 milligram metformin. I have now 1,000 milligram metformin. Now I have 1,000 milligram metformin and 2,000 milligram metformin. Now all that your sugar is continue to go up, and eventually it doesn't go up. Then what? Doctors say, well, in that case, sir, you need to start getting insulin. So we'll give you 5 unit insulin, 10 unit, and 20. As time goes on, it's on and on and on to lower your blood sugar." And how they do that, they continue to ask you to pluck your finger, measure your blood sugar 2 hours after it. If your sugar are continue to be somewhere in the neighborhood of 160, 180, wow, then you really got to bring the sugar down. You can't stay there, or you are actually 7 or 8, 9 millimole per deal. You got to continue to bring it down. You cannot leave it there. So So you really, if you're 7, 8, 9, you got to bring it down. And you're 180, you got to bring it down. I mean, normal, not before, not that's mean your before eats, your blood sugar is high. You know where your blood sugar is very high. And that's mean, what that means is because the pancreas unable to give you that insulin to basically to compensate to take the sugar in the cells. So net result, even with the extra insulin, it doesn't work. So you have an insulin resistant. And if you do that, the diabetic will usually, over time, the medication will continue to go up. Or if you're not in medication yet, if you're pre-diabetic, when you get down to A1C of 6.4 and up, and up, and up to go to 7%, A1C 7%, doctor definitely will give you medication. And they will basically say, hey, you are really now diabetic, you have no control to bring it down. And once you get that, once you're on medication, your record will be you are diabetic. So everything is going to be set, insurance goes up, and come along. And really adding more medication is a very common cause, or adding insulin is also a very common cause. A lot of people just say, well, your blood sugar goes up, you really no choice, I will give you more insulin. So net result, they will also, the doctor might say, okay, you really get your blood sugar below, your A1C has to be below 6.4. They will give you a target sometimes. A good doctor will say, hey, I need your blood sugar to be 6.3%, your A1C 6.3%. Let's work together to get that. Now, a lot of doctors will do that. Or you have 7% now, I want to draw a drive to 6.5, eventually 6.4, and you have 6, and stay around there. So they will help you to set target, and you work together to achieve that. So the type of change is one, definitely change of medication. If you have no medication, it will increase medication or get medication. And if you have lots of medication, it still doesn't work, inject insulin. That is a very common cause. However, do this, they expect change. Sometimes you have a booster with, LOWSUTEA might help you to eliminate that additional medication, not to get all the medication off, because that booster, you might not no longer need the insulin injection. Now, let me share with you, a lot of my clients now, they used to have insulin because of LOWSUTEA. It helped them so much that the insulin actually be eliminated, but they still in all medication. A lot of doctors don't want to give up that. So at least you don't have to book yourself every day. And you go travel a lot more easier, because insulin, when you travel, you know what? You have to put a little ice box next to it, make your insulin cold. You got to go to a hotel, you have to put an ice box. There's a lot of extra work. So just all met is so much better. So at least you have a better lifestyle with that. So anyway, that is something to think about. 各位堂友，其實喺個轉變嗰度咧，有咩轉變咧？好重要嘅轉變咧，好多時咧，當你一路係糖尿病嘅時候，好多時轉變咧就係你個藥會轉變。你個藥轉變好多，因為醫生咧最緊要咧就哇，你見到你血糖係咁高嘅時候咧，佢一定會加藥。好多病人都話：哇，點解你加藥有500 mg 麥當明又上去1000個，然後有2000個，唔得之後就話阿 Sir 你要打胰島素，由5個 unit、10個 unit、15個 unit、20個 unit 都咁加上去嘅。咁因為點解咧？當你係唔夠 insulin 嘅時候，或者你好多個所謂 insulin 嘅胰島素抗拒咧，咁佢一定要加藥俾你，能夠令到你係將個血糖降低。因為如果你血糖唔降低咧，你頭先所講啲問題咧係會繼續出現嘅。佢一定要由呢個方案咧係幫助你唔會有啲問題出現。咁其實咧，當你係譬如好似我依家係就係前期患病者啦。如果你血糖繼續高，或者我依家係糖尿患病者，但係初期啫。當你係如果你係已經係 A1C 6.9去7，一路再上去，醫生會一定話俾佢哋食，或者你係已經糖尿病咧，佢一定加藥俾你食。所以咧，呢個係好 common 嘅，加藥同埋 insulin 好關係。所以有陣時咧，飲咗去糖茶係好大幫助，因為好多糖友咧，依家係飲咗去糖茶之後，原本要打胰島素唔使打。跌翻落嚟去6個 A1C 去6嘅時候，咁個醫生好 happy 啦。嗱，當然咧唔係淨係飲去量茶啦，要 exercise 轉你 lifestyle 嗰啲一定要做晒啦。咁所以其實好多醫生咧就睇住依個 A1C 係一個高嚟嘅，即係你個目標。咁你個高係咩 ？A1C 哦，原來你而家我要你做到開始由7去6，然後6點去6.5、6.5去6咁樣嘅。 咁所以好多好嘅醫生就應該俾啲高你去 achieve。咁呢幾樣嘢咧就係我哋現在咧一個將來你 expect 改變係呢啲咁嘅改變。咁所以其實咧你唔可以就話啊以後都係講唔會咁嘅，一定會改變。OK， 嗱，點解你係需要多啲胰島素 ？Why you need more insulin？ Now because a lot of time when you take all medication and now doctors say you need more insulin, a lot of people will say, wow, my goodness, I'm scared. I don't know what poke myself is really not good. I don't feel like, well, first of all, don't feel fear to get your insulin because if you really require to get insulin, it's actually need to have it. Although your insulin, you have to poke right here on the stomach area and or subcutaneous on the arm and whatever. It is something that you got used to, and it's going to be a little painful. But once you get used to it, it's okay. And it doesn't mean that you are not able to manage your diabetes, just that your body just doesn't respond to the insulin. So you need additional insulin to help you. And you have to take that effort to do that. Yeah, you have to control your lifestyle. And to be honest, you got to drink some LOWSUTEA to try. See whether you have the opportunity to reverse the insulin, no need insulin, to reverse the situation. You do not need more insulin and get back to only strictly oral medication. And we have a lot of patients, actually, they were required to take insulin, but after drinking LOWSUTEA, you know what? They now no longer need insulin because the oral medication can able to get them down to about, with LOWSUTEA to get oral medication, they are able to get the A1C to 6, between 6 and 4, 6 and 5. The doctor will be able to provide that to you. Now, if you don't get that, well, if you don't get enough insulin and you don't want to take injection, the oral medication, even take a lot more oral medication, might not necessarily enough to get you through, the hump to lower your blood sugar. So that's something that's why I said, you need to try LOWSUTEA really in a good regime, plus changing your lifestyle. Hopefully that will change your insulin to be eliminated by injection. You can just, because LOWSUTEA has the special capability to take as a booster, like take the insulin, take the sugar into the cell, just like the insulin. But on the hand, you got to try. If you don't try, you don't know. Okay. So a lot of our patients right now actually try and become successful, but they also do something later on. We'll share further and discuss. You have to change your lifestyle. You cannot just say, I love ice cream, 3 scoops. I take my medicine, I can scoop myself 3 scoops ice cream, I'm okay. It's not okay. You got to do your part, changing lifestyle, diet control, exercise, and weight control. And that will be together. I will talk to you a little bit more. So very important. If you need insulin, you might need the injection or try LOWSUTEA to help you to lower the blood sugar. If it works, then you can eliminate insulin. That will be wonderful. It's just oral medicine, right? OK， 嗱，各位堂友，可能咧你係有陣時真係要需要呢個胰島素嘅，因為如果你唔夠胰島素，或者你嘅你本身身體咧真係已經係好多insulin rejection 咧，嗰時候咧你就係需要胰島素，係咪？咁其實打針係咪好痛苦咧？嗱，當然咧就如果你習慣咗就唔係好痛苦嘅，但係頭啦係好驚嘅，因為篤自己啦嘛，篤喺肚嗰度啦，又篤喺subcutaneous鼻嗰度啦，哇好多地方都好驚喎。咁其實當你 used to 呢個唔使驚嘅。咁但係咧，呢個係一個重要嘅東西去 manage 個 diabetes。咁你係要即係 take 呢個努力啦，去轉你嘅生活習慣啦，食嘢啊、exercise 啊、運動啊、磅數控制啊，同埋可能你飲去糖茶咧，你係能夠 reverse 咗，即係轉變咗你呢個要繼續打胰島素嘅。嗱，好多我哋嘅病人咧就係咁啦，佢飲咗去糖茶之後真係好用功飲喎，唔係飲一包喎，你每日要係飲2包，同埋要飲8杯茶。當佢飲咗呢樣嘢嘅時候咧 ，guess what？ 佢胰島素真係降，即係佢個唔需要咁多胰島素咧，佢係個血糖真係降低嘅喎。咁佢變咗醫生就話：哇 ，OK 喎，如果你 A1C 跌到6.4以下咧，咁你就其實唔使打胰島素住，繼續 oral medication。呢個係一個好好嘅即係幫手啦。咁如果你係有呢個情況，應該試下係飲去糖得唔得？ 如果係得嘅話咧，哇！呢個就舒服好多。咁好多朋友咧，都係依樣嘢嘅。但係好多時咧，我話俾你聽，好多朋友亦都唔記得嘅，因為佢哋咧做咗之後咧，佢飲下就飲一包嘅啫，一包茶就唔夠嘅，因為一定每日有2包嘅。有陣時咧，有啲人咧飲下就即係飲包茶，成日都係飲嗰包茶。咁同埋咧，亦都或者係飲2包茶，但係我啲兄咧每日即係飲2包，1杯2杯咁多。即係唔得 consistent 啊，唔得即係好積極去飲晒嗰8杯茶，食飯前、食飯後，每次都係咁去做咧，好多人冇做呢樣咧，咁 end up 又唔 work 嘅喎 ，OK？ So very important if you gonna try LOWSUTEA, make sure you got 8 cups of tea. You have 2 bags, 1 bag in the morning and lunch, meaning that before breakfast, after breakfast, and then before lunch, after lunch of that the bag total you have 34 ounces or 1 liter tea are being complete finished. And dinner time, again, before dinner, after dinner, and then after dinner, you have having some dessert or some resting, you get 1 more cup there, which is, and the last cup is 1 hour before you sleep. So you have that 8 cups of tea. The reason is you want to make sure the whole day, your body actually handle the blood sugar in a pretty nice, low range, like for example, under 120 or under 6 or around 6 to 6.4. So you can able to manage your blood sugar, not go up and down and high, you know. So that is so important. So you have to be consistent drinking that tea. Then you can able to actually eliminate your insulin rejection. Because your blood sugar go down, then it's okay. Then you don't have doctors say, okay, you can go oral medication then. Now, unfortunately, as we old, diabetic management also change with age. Okay, as no doubt, our body will be start aging. Since this is a lifelong disease, your body will change over time. And the problem is when we body change, you face all sorts of aging issue. Like for example, the skin become dry, your nerve become painful, or actually getting numb if you have numbness of your nerves damage. You can affect your heart, you affect your eyesight, affect your kidney, and worse that you lose some of the memory because of diabetic nephropathy. Dementia. Diabetic dementia affect your brain, where the brain small micro vessels are plugged by your plaques. So net result, there's no nutrients, there's some kind of back of the brain. So all those memories are going lost or don't remember. Short-term memories have become very poor. So those are things that will come along. And that's why, you know, now they said type 3 diabetic is Alzheimer's disease. So all that will come along as you go old. And so all that you will be basically just some kind of adjustment, okay? Now, and when you get old, you might have osteoarthritis or just arthritis, okay, which is not related to diabetes. But the problem is because when you walk, you got painful. So it does also affect your going to exercise, because you say, man, it's so painful, I don't want to go exercise anymore. So with that, you don't exercise, you don't burn off your excess fat, calories, and carbs. So your blood sugar also go up. So all those body change issues might rise that you need to adjust your diabetic management. So really, at the end of the day, as we go move older, we have a lot of things we need to change. You know, you might say, I can't walk anymore. Like a lot of old folks. I have a patient who is 89 years old. Unfortunately, now he's getting weak. He can't walk anymore. He used to be able to walk around, do exercise and so forth. Now he can't walk anymore because he can't, you know, hold himself in a body. So again, with that, he can't exercise. So really, at the end of the day, his blood sugar start moving up because of the fact can't exercise. So as you move on, the body changes. You need to continue to adjust, and has to be, you know, have other things. How can we help each person to change? Instead of walking exercise, maybe now you have to sit down on a bicycle exercise, like my 89 years old friend who cannot walk. He cannot walk, you know, 10,000 steps anymore because he's old. And so now he changed his exercise from a bicycle sitting down. He still do 30 minutes slowly, and while he watching TV, and he move his arm up and down, but he's sitting down. He's not walking. He just do this, and his foot is just going on a bicycle. One of those sit-down bicycle. They're very cheap. It's only like $60-70 US or $300-400 one of those, and he go around to continue to do their leg exercise. Now, he doing that is really helpful because it start moving his joint. It's not really just continue to get, nothing moving. That will be sad for this individual, okay? But at least he's making the change. 嗱，各位堂友，如果你係糖尿病病者咧，當你老啲嘅時候咧，你好多嘢轉化嘅。嗱，因為點解咧？其實當你老啲嘅時候咧，你身體亦都會改變啦。你所有嘅 organ、所有嘅胰臟都會改變啦。咁所以其實咧，你亦都會有面對不同嘅問題，好似心臟病啊、腎有問題啊、眼有問題啊。如果你長期唔 take care 你眼嘅時候，你可能真係會青光眼盲啊，或者嗰啲 skin 即係嗰啲皮膚好乾燥啊，會痛啊 ，nerve pain 啊，或者記憶唔得啊。或者有 numbness 啊，或者冇嘅感覺啊，哇！呢啲啊繼續嚟嘅喎。咁同埋好多時，當你老嘅時候咧，佢好似話有風濕病，但唔係 related diabetic 㗎。咁但係風濕病係痛啊，咁你唔會行咯，唔行嘅時候呢血球會高嘅喎。咁同埋我話我有個朋友，即係有個我哋嘅去頭站嘅客仔啦。咁其實咧，佢係89歲啊，咁但係佢已經好即係個人咧係行唔到啦。咁點樣去做 exercise 行唔到，咁咪坐喺度啊？咁佢唯依家咧就唯有踩單車。佢有個單車坐喺椅嗰度咧，係可以踩嘅。咁呢個單車嘅時候咧，佢每日咧踩半個鐘頭。咁踩嘅時候咧，佢係喐下呢隻手啦，咁又喐啦，喐啦，咁亦都喐半個鐘頭。咁朝頭早佢做一次，夜晚做一次，咁又 OK 喎。佢個人可以做到呢樣嘢喎。所以變咗嚟講咧，你係要繼續咧，係要努力咧，係做不同嘅嘢，就唔可以俾佢就咁嘣一聲，算啦咁咩都唔做，企喺度啦。咁其實咧，咁呢個咧反而唔得嘅。佢因為佢 burn up 唔到 excess sugar，咁所以變咗嚟講咧，佢一定要繼續去努力，要跟住個年齡改變，做不同嘅嘢咧，係幫助佢咧係降低佢血糖嘅。所以變咗嚟講咧，佢呢個咧係即係如果你當老啲嘅時候咧，就唔好以為冇啦唔喐啦唔得嘅，繼續俾喐，因為喐咧係多咗幫助佢咧係令到佢啲joint 啊嗰啲膠啊全部都做得好啲。OK， so important in really as you move on to diabetic, it's so important you always have to eat properly, and you have to be because eating will impact your blood sugar, really, because if you don't eat well, in the sense that like plate planning, half of the plate are all vegetable, meaning green, all green, but no starchy vegetable, meaning no corns, peas, but it'll be all green leaf salad. And quarter plate is mainly fish, so you get all your protein, and then you have your quarter plate is going to be your fiber with brown rice, so that way you are a well-balanced diet, and instead of eating a lot of fats like items like fat pig's skin, chicken skin, all those should be eliminated. Just chicken itself, lean chicken, lean meat. And certainly you really cannot take a lot of so-called sweet. Now, let me share with you, this is a real story with an Egyptian client of mine in Egypt, actually. And he was explaining to me the family had 11 members, and 11 members, one of them are pre-diabetic, rest of them are diabetes. And the thing is this, with this, they start realizing a lot of people are drinking tea. Every time they drink tea, they scoop a spoon of sugar. And if you have six cups of tea, you got 6 scoops of sugar already, plus all the food. And on top of it, eat a lot of fatty diet. So net result, many people just become diabetes. Now, are we doing that? I hope not, because we hope that we really eliminate that sugar and then you can able to really keep lowering your blood sugar. So that really the habit eating less carbs, less fat, a lot of greens, that becomes so important to you. You have to establish a habit. On top of that, when you buy things, make sure to read the label, even milk. A lot of times I realize my milk is only 5 gram carbs. Some milk is 16 gram carbs. So when you drink a cup of milk, one is 16 gram, might be taste real good because a lot of sweet. One is 5 gram, not so sweet. But on the other hand, you drink that, got what? You know, each day won't have 140 gram to 200 gram carb. You just blow it up, okay? You drink 2-3 glasses, you get rid of all your carbs. I mean, your carbs is already fulfilled the daily requirement. So you really got to look at your label. On top of that, really can't take any white bread, white flour. Try to eat all, you know, brown wheat bread. The sugar, Coke, cakes, cookies, had to eliminate. Now, I know it's very tempting. This Christmas, a lot of people gave me a lot of cookies, for example, and it's right in front of you. You want to eat some? Wow, man, it's really terrible. So I usually eat about 1/4 of it. But even with that, I have just eat a little bit at a time, so I can only satisfy a little bit. I say, okay, this cookie is pretty good. But I can't eat the whole cookie because if not, it blow up my blood sugar. So those are the kind of things that you have to continue to maintain, to remember, to contain your blood sugar. And now certainly, if you have a dietitian to help you out, it's good to check with the dietitian, what are you eating? But if you don't, just read the label, say how many grams, add it up together, does it meet 140 or no more than 200? That is the range you look at. And you should have at least, you know, also it's good to also track the amount of sugar. Besides sugar, around the water intake. But very important, you have to continue to drink LOWSUTEA because that will help you to lower the blood sugar, cholesterol, and blood pressure. So keep up that because diet is one of the key elements to lower your blood sugar. 嗱，各位同學，嗱食得健康同埋要保持食得健康係好重要嘅，因為你食嘅嘢係會 impact 會影響你全部嘅血糖嘅。咁但係點樣做呢樣嘢啊？嗱，當然咧，你每日都要食啦。咁食嘅時候咧，最好就有個 plate planning， 一半全部係菜嚟嘅，咩嘅綠色嘅菜都 OK， 就唔好豆啊、corn 啊，即係粟米啊嗰啲就得㗎啦，因為佢哋係 starchy 嘅vegetable。咁同埋咧，仲要食好多 protein 係魚啦，1/4魚啦，仲有1/4嗰個咧係嗰啲叫 high fiber 嘅食物啦，好似譬如紅米啊或者brown rice 啊呢啲東西咧，咁能夠令到你一個 plate 係咁樣之後咧，你已經係控制晒所有嘢係 will be very good，will be 更加健康。嗱，當然啦，你又唔可以食好多即係cake 啊、cookie 啊、雪糕啊呢啲嘢就唔好意思啊，就真係要食得好少好少。如果食一啲咁多，好似朋友送俾我啲餅乾，我食1/4塊已經好多㗎啦。其實就，但係同埋汽水啊就唔好飲啦。依家 OK， 咁仲係食咩都好咧，真係度下 label， 因為原來牛奶有啲係16 gram 牛奶，16 gram carb 一個牛奶一杯啊。我依家飲嗰啲係4至5 gram 嘅啫。咁所以變咗其實就牛奶咁簡單啊，其實都可以 increase 你嘅 carb 好高嘅，因為一日咧我哋能夠只係到140 gram 至200 gram carb， 唔好多200 gram， 所以其實咧一定要繼續控制。咁如果你有 dietitian 嚟傾下偈咧，咁亦都係了解多你食嘢，可能個 follow 個 dietitian 咧。如果冇嘅話，就繼續係睇你個 label 食乜嘢，然後加埋，咁即係知你係咪夠140至200個 gram 嘅碳水化合物啦。咁同埋咧最緊要飲去糖茶。嗱，飲去糖茶真係會幫助降低你血糖咧、膽固醇咧同埋你血壓嘅。咁呢個咧係跟真係繼續要你去繼續去努力去做呢樣嘢啦。Now, exercise is so important. Now, exercise actually increases your insulin sensitivity, and your body will use because exercise will use more insulin effectively to get all your sugar into the cell. So really exercise can really help you to better manage your blood sugar. Now, each day you should have at least 30 minutes worth of exercise. You walk 10,000 steps, you have at least 1 week, have 150 minutes per week of exercise. You gotta keep doing that, okay? The exercise program might also change as you go. As I said, might change with age, especially when you get older, you really can't do a lot of fast walking anymore. So you can basically maybe sit down in a car, in the chair, and then do this kind of bicycle exercise, moving your hand up and down, like my 89 years old client. So with that, you can still burn up all your exercise, moving your joint. And more importantly, we found that walking is very good. If you can walk all the way to 90 years old to 93 years old, which I have a friend who is now live at 99 years old now. He's a golfer. At 93, he's still playing around a golf, three-hole golf course. And I was amazing. I went to golf with him, and he beat me all the time because he was so good in the sense of, all along understand which holes do, and he was still walking all the way through the golf course, and so good. So imagine, walk is a very important exercise. Now, some people choose dancing. That's good. Whatever you do, just keep moving and exercise. That will be the key to help you to keep your insulin effective, decrease your insulin sensitivity. 嗱，各位朋友，其實咧運動係好重要嘅，你係真係保持身體健康咧。當你老啲嘅時候咧，呢個係好重要嘅，因為咧如果你有成日運動咧，你如果有敏感程度咧就會上升嘅，同埋咧亦都會幫助咧多啲胰島出嚟咧係幫你 burn off 你啲 sugar 嘅。咁每個禮拜咧最少喺度150分鐘嘅 exercise，150分鐘嘅運動。當你有咗呢樣嘢咧，每日最多有30分鐘咧就會 be very good 嘅。OK， 咁當然啦，你運動嘅時候係做咩運動啊？嗱，其實最好咧就行啊，因為行咧你係容易去 maintain，因為好多時有啲人咧運動咧就一個禮拜一次，第二個禮拜就要做一次，整體係唔記得咁多次，所以咧其實你每日都行咧。行1萬步咧，你就真係都記得到。就算冇1萬步，8000、9000步都 OK 嘅。咁啊，繼續去做呢樣嘢。同埋當你老啲嘅時候咧，你可能行咧，你行得慢啲，但係都繼續去行。我有個93歲朋友，就算佢依家係93歲朋友，都係打到 golf， 仲贏咗我嘅。咁我真係佢係好叻仔啦。咁但係佢身體健康係好正。佢依家99歲唔行得啦，咁佢做咩？就呢個屋企個 exercise， 呢個運動咧個單車。咁但係佢身體仍然好健康喎，記住啊！所以行咧係好大幫助你更加身體健康。So exercise, stay active is so important. Now you cannot, for example, you don't walk a lot. Well, do yard work is okay too. Whatever you do, just keep doing activities. Now, weight control is so important because if you lose 1% of your weight, 10% of your weight, 10% weight. So if you are 200 pounds, you drop yourself down to 10% is actually 22.5 pounds. Your A1C will drop 1%. And that's exactly what happened to me. I was 220 pounds about 4 or 5 years ago, and I dropped 10%. Right now at 195. My A1C actually was 6.9. I dropped down to 6. And that was really good. The doctor said, see, I tell you, you drop 10%, your A1C will drop. So potentially your A1C, even though you are maybe 8, you drop 10%, you'll become 7. So that will be wonderful. If you're 7, at least you hopefully will go down to 8. So that will be a major change to help you drop your A1C because fat will continue to maintain your blood sugar much higher. So really lower your BMI under 25 is your goal, and drop 10% of your weight is also a goal, and continue to drive the weight to go down to BMI 25. And if you are saying, well, it may be hard, well, just drop 10 to 15 pounds. It's already make a lot of difference on your management. So talk to your doctor, or if you doctor don't actually talk to you, just try to get yourself 10% lower. You will definitely see your A1C become tremendously improved. 嗱，磅數係重要嘅。如果你磅數係過咗係A1C 你個磅數係 譬如10% 嘅磅咧，跌低過10% 磅咧，係會 drop 你嘅 A1C 大概1個 point 嘅。譬如你而家係 A1C 係7或者8咧，你會 drop 咗係7㗎啦。如果7就跌咗6㗎啦。咁呢個係一個好 natural 嘅東西嚟嘅，多數係咁，我自己都係咁嘅。咁所以變咗嚟講咧，所以喺你個重磅嗰度咧減到佢10% 磅數咧，係會好大幫助血糖控制。所以咁如果你係就算話我講唔到10% 喎，哇減10至15磅你 OK 㗎啦 ，OK。咁最緊要係繼續減你個磅數，去降低個 BMI under 20%。同埋咧 ，so really at the end of the day, you really need to continue to check your blood sugar. The reason is you don't check your blood sugar, you know what? It's very difficult to understand where you're at. Now, in Hong Kong, I think in the United States, a lot of people will have the Abbott Libby, which is the machine that right here. Everybody have this. And that's real good because painless. I just remember how to measure that. And every day you can at least understand where you're at. Because that is, to me, is a really good motivator. The Libby is actually help you to understand where I'm at all time. Now, the reason why I say that is because if I eat a donut, for example, wow, after eating my donuts, my blood sugar went up to 180 or my blood sugar went up to 14, 16. You know what? Is a motivation that, well, I better stay away from donut because that will raise our blood sugar so high. If you don't do that, you just ate the donut without knowing your blood sugar, you're like, well, that's nothing happened. So I continue to eat donut. And that will be terrible for your blood sugar. So I found Abbott Libby is really a good things to help you to measure yourself. As you know, when you get age, continue aging, your blood sugar might be changed, might be continue to go up, and you have to really more frequently check your blood sugar. Now, certainly, a lot of people in the Philippines or other places, they don't have Abbott Libby, no problem. Just poke your finger 2 hours after you eat. Measure with a finger pricking stick and measure. Once you get that, you start realizing, wow, after I ate that, my blood sugar went up to 16 or went up to 180, then you will be very motivated not to eat any more donuts, okay? So you will be doing that. Now, with that, also, you have to measure your average daily blood sugar. Now, with the Abbott Libby, it's actually more convenient because it will tell you every day what's your average blood sugar. If not, you have to calculate it, add it up all together, and then divide the time of occurrence, so you know what at least what is the average blood sugar. So especially people take blood insulin, if you do insulin injection, you definitely have to do your blood sugar. Is it too low? Is it too high? Is it in control? And you have to talk to a doctor to prescribe you. I know in the United States, you have to have Abbott Libby prescribed, but you have that capability, you have to ask the doctor to prescribe that you can get that Abbott Libby. It is really worthwhile to get that. Now, also when you drink LOWSUTEA, you actually relate the LOWSUTEA with Abbott Libby. You can actually tell, why, am my blood sugar going up? It's better control your blood sugar. And you really can able to decrease all your risk of diabetic complication. If you continue to measure, you know what to do. And have to motivate you to continue to stay healthy with less lower blood sugar and continue as a very important diabetic management. So this is something that you should have. And usually, typically, people using Abbott Libby, they measure about 14 to 16 times. Imagine they measure 14 to 16 times a day. So they have a very good graph under exactly what it is, going up and down. Am I too low, too high? All understand. Now, eventually, I think Apple next year also will come up with a watch, might be, but that will be a year away, that are able to understand your blood sugar. So I think if we get that, wow, we're wonderful. I will buy that watch also. Continue to measure blood sugar. That will be perfect. But anyway, right now, Abbott Libby will be probably one of the easiest choice, affordable, typically about $70 per 14 days. So it's US dollars or $520 Hong Kong for 14 days. It's affordable. It's good management tools. 嗱，各位朋友，如果你係有糖尿病或者前期患病咧，如果你冇血糖監測咧，你係真係唔知你喺邊度。你唔知道血糖高啊低啦，咁你一就係篤手指。如果你冇 Abbott Libby，你就要篤手指。咁 咁最緊要督咩手指啊？第一個係督你2個鐘頭後食咗嘢2個鐘頭個血糖係點樣啦，或者你朝頭早起身個血糖係點樣啦，你要知道。咁最單度一日最少都要度4次。咁但係如果有 ability 咧就唔同喎，你係任何度都有，多數啲人係度14至16次，每日度都唔痛嘅，因為你隨時度到啊嘛。咁就 OK。咁所以咧 ability 好重要，同埋 ability 仲可以話埋俾你聽嘅 A1C 係幾多啦，同埋仲有咧係知道每日嘅 average blood sugar 幾多。咁你就喺依度咧 ability 唔係淨係睇到血糖啊，但係俾一個鼓勵性嚟話俾你聽，哇！我係幾 O 唔 OK？ 現在係點嘅情況？咁變咗嚟講，你又變咗唔同咗咯喎！你係能夠知道啊，我知道原來咧，我係可以咧係繼續努力去控制個血糖。如果係食個冬甩，我度咗 ability 我就唔會食冬甩，因為呢班血糖高啊嘛。或者食個麵包，或者食個叉燒包，你要知道，我有老婆就咁啦。佢每日食叉燒包，但係有 ability 度咗之後咧，佢連叉燒包都戒埋，哇！真係開心。佢血糖依家係6點幾嘅啫。咁你話係咪好重要 ability？ 所以控制血糖一定係一樣。咁如果你飲去糖茶咧，你一定睇到 ability 嗰度咧，睇你個血糖慢慢降低。咁你就知道咧，呢個係真係 work 嘅。同埋咧，亦都係因為你控制到血糖咧，你減低好多你血糖嘅風險啊，即係血糖高嘅風險，或低嘅風險。嗱，you know, understanding more about diabetes is a lifelong disease, but you really have to gain more and more newest information, continue motivated to learn how to control disease. And the way to do it is certainly we give you a weekly webinar, and we have like 100 something webinar already. So you really know as go on what will affect you by your diabetes. So the webinar is so important for you to motivate you to learn, to control, and ask questions. Certainly a lot of people ask me questions at nighttime. Oh, I get this, I got that. What can I do? And I help them to understand, alert them at least this is the tips to do this, to manage. Our goal is here to use the webinar to give you management. The total management is not only to say, oh, just diet. That's not what I try to do. We'll give you the principle, the total management. We'll get into depth of understanding what you need to do and help you to understand. So when you understand it, you know what? You better understand the control. So that way you have at least a real scientific, professional information, have better method to manage your blood sugar, including the diet, exercise, weight control, blood measurement, and also important, get your webinar to understand the signs and symptoms you look out for, and then all the complications you might able to face, and so you don't get into deeper complication. If you can continue to able to understand it, to stop those complications by controlling a better blood sugar. So these are very important to understand. Attend LOWSUTEA webinar weekly, okay? Because you can able to refresh yourself. It's very interesting. I just talked about my client. He said, Andrew, I love your webinar. I said, why? He said, although I think I know everything, but I forgot. And now when you talk about it, I remember, refresh my memory, and I guess what? I remember it and I start doing it now. So they will really need to continue to be reminded to understand what next to do, and they will do it. And you know what? She was able to lower her blood sugar and continue control. And that is so important. That's why listening webinar is very important. Yes, although you invested 1 hour, but at the end of the day, that will definitely help you to be healthy, and you can even talk to your friends. As a matter of fact, I encourage many of you, if you see my webinar is worthwhile, send it to your friend. It's okay. I love to let them to hear what it is, and they can better learn. I told all my clients, feel free to share with webinar, because as long as you can help your friend to lower blood sugar, I'm very happy. Thank you very much. Ask them, send that to their friends, help them to better understand. 各位朋友，其實咧聽過我哋線上講座咧，其實好重要嘅。點解咧？因為其實好多人都話，我知㗎咯，但係好多時你唔記得咗啊。我唔記得咗嘅時候，弊家伙啦，你唔記得咗，繼續，都係同樣做嘢冇改變。 咁你血糖咧係真係要繼續知道咧，原來好多新嘅方法出現啦，食嘢又改變咗啦，同埋你啲即係醫生講座或者專業講座，好似我哋而家係護士嘅講座咧，嗰啲嘢係好正確嘅，能夠令到你唔係話淨係食，但我係希望俾到個全個即係血糖係糖尿病嘅管理嘅故事俾你。當你有成個故事管理咧，有裏邊有咩點解會令到你血糖好高啊？胰島素點解好高啊？要高啲啊？嗰啲嘢全部知道之後咧，咁你就會有一個好嘅知識咧，幫助你控制管理整體嘅糖尿病管理。咁呢樣嘢咧，好多時咧，你可能記得或者你識嘅，但係你可能唔記得咗。當你聽咗呢個seminar 之後咧，你就會記得翻咯。咁你就會繼續去做呢樣嘢，係咪？咁同埋仲有嘢咧，我哋俾好多 tips 俾你啦，啲有咩症狀出現咧，咁你可能知道，哇！原來我呢度個眼開始有少朦咯喎，咁我知道要做啲咩咧？因為呢個可能diabetic，即係個glaucoma 啦，咁啊睇醫生啦，咁早啲去防禦咗，去 prevent 就繼續 worse，OK？咁所以變咗嚟講咧，呢個係一個重要嘅做嘅東西，所以記住真係要聽多啲我哋嘅線上講座啦，咁同埋咧。雖然係1個鐘頭，但係呢個係一個好嘅 investment 嚟嘅。Okay, so in summary, you know, diabetic is a long-term disease. I know you've been working hard to control that disease, and the condition continue to change, and you might have to all kind of adjustment if you're diabetic to manage your progress. The worst thing is you don't want to get worse. You know, where A1C will continue to maintain under 6.4 will be the best for you. Now, you might actually even 6.4 go up to 6.5 and come back down. Yes, that's a possibility. But importantly is continue to manage that, continue to look at that. Don't let it go up. You have to continue to really understand how it goes there. Now, to do that, you know, there's quite a few things you will end up. One, the doctor might actually adjust your medication. A doctor, unfortunately, will keep going to increase medication, insulin. So how can you do that? Well, maybe you can think about using LOWSUTEA as a booster to help you to lower back that blood sugar down, A1C, continue to drink it thoroughly, meaning you have to drink 8 cups of tea a day, hopefully control that blood sugar continue moving down. With that, you also will when you blood sugar go down, hopefully the doctor will eliminate insulin injection just to keep you oral medication. So it make your management a lot more easier. Now, naturally, you might not never get off medication, or you could get off medication if you're diabetic as well controlled. Certainly with that, your body will change also, change by age. When your body age change, you have all kinds of things you have to adjust. Maybe you cannot walk anymore, or you become weak. You have to do exercise through sitting down as a bike and moving your arm, continue to move. And so that's what you got to do. And on top of that, you have to eat healthy. As I mentioned, plate planning is so important. Half are all salad, green, no starchy salad. Half is low fat, protein, fish, low lean chicken, lean meat. And then 1/4 will be mainly your fiber food like brown rice and so forth. So those are a really wonderful thing. And certainly you have to drink LOWSUTEA, continue to drink LOWSUTEA, 8 cups a day to help you give you low blood sugar. So you have to exercise. Exercise really go with age change also. So you have to walk will be the best thing. Continue to walk. You might go 89 years old, still walking, even better. And you have to weight control, losing 10% of your weight, you lower your A1C at 1%, which is wonderful to lower blood sugar. So even 10 to 15 pound drop will much better to manage your diabetes. And in order to understand where you're at, you have to continue to check your blood sugar. And checking your blood sugar, you have a couple of things. You have to use Abbott Libby to check your blood sugar. You know, get this gadget out here to check your blood sugar. Or you can poke your finger at least 4 times a day after meal. You see my blood sugar now is 5.9. I didn't make this up for you. It just you know measure and was 5.9. You notice I drink LOWSUTEA. Guess what? The whole graph never go up to over beyond 8. Okay, so that is how it is good for you to look at your blood sugar all the time. I measure a time. I measure at least 14 times a day, so I know exactly where I'm at. So you got to continue to do that. And on top of that, you have to poke your finger 2 hours after any food intake, like breakfast, lunch, dinner, and then you can take one more time first thing in the morning. So you know your blood sugar are going up high or whatever. And then you have to continue to listen to webinar come from us, where we can give you all the sign and symptom tips to continue to measure, to correct action that you can lower your blood sugar. 嗱，各位同學今日講嘅嘢咧好緊要嘅，因為點解咧？糖尿病係一個慢性嘅疾病，係永遠唔好嘅，你一定要長遠去控制。如果你控制得好嘅話咧，咁血糖繼續降低咧，你就冇咗好多糖尿病嘅併發症啦。咁其實咧一路落去嘅時候，醫生就一定俾藥你食嘅，繼續俾藥，繼續高，有時500 gram 就唔夠1000 gram。咁其實咧，你可能要真係咧食藥打胰島素。如果你係飲多去糖茶咧，你可能將個胰島素最低唔使打胰島素啦。咁梗係食 oral medication 好過咁啊，唔係咁辛苦要打針啊每日。咁同埋咧，仲有你每老嘅時候咧，你個身體會改變嘅。改變嘅時候咧，你好慘啊，因為好多嘢係做唔到，行唔到啦。咁你點樣做 exercise 咧？咁呢樣嘢咧都要控制翻。譬如老啲啦，行唔到啦，就要踩單車啦，坐喺度踩單車。食材好緊要，每日都要注意你嘅食材啦。我講咗係我哋食飯咧，一半就係全部菜啦，4分一就係魚啊，同埋唔係肥嘅東西啦，4分一就係佢所有嘅纖維嘅東西啦，好似brown rice 啊、紅米啊嗰啲咁東西啦。咁同埋咧，仲要咧係你磅數控制啦。磅數控制咧，你個 BMI 降低 under 25啦，要繼續降低10% 嘅重磅咧，你 A1C 跌1%，哇，好重要喎！咁啊，繼續 exercise 啊，老嘅時候你都繼續行到你90歲都繼續行，咁你身體一定好啲嘅。咁當然啦，如果你唔去check 你個 blood 咧，即係你個血管係唔知幾多喎。咁所以其實咧好重要咧，可能你真係需要咧要有呢個 Abbott Libby。如果唔係咧就度血糖咧，你有呢個你嗱我血糖咧依家咁度一度啊，好簡單5.9，我就咁度一度撳一撳啫嘛，咁啊5.9啦，咁就知道啦。咁我其實一日咧我係度大概有幾多次啊？大概14至16次16次咧，睇下5.9。嗱作唔到俾你㗎，呢個 number 係啱嘅，J 個 number 係只係呢個機作出嚟嘅啫。咁所以同埋咧聽書亦都知道咧。好多問題咧，你有咩symptom啊，有咩症狀出現咧，你亦都知道點去處理。咁呢啲咧全部係一個好重要管理嘅情況。咁希望大家係繼續身體健康 ，lower your blood sugar. Well, today webinar I hope will give you a good overall again management of diabetes. We know we're going to change. I know that there are some questions already. Maybe you can plug your question in your question. And then we'll go from there. Now we have some very good questions from Eugene. First of all, they said how often does Abbott Libby take reading? Okay, let's answer the question first. Eugene 好高興咧，有個 question 咧，佢話你每日咧如果有 Abbott Libby 讀幾多次咧？其實最好咧，你可以讀第14至16次。嗱，唔係之後咧，你最好都係每一次未食嘢之前讀一次，然後咧。就係食嘢之後再讀一次2個鐘頭啊！Typically, a lot of people from Abbott Libby, they actually Abbott Libby typically they will basically measured at least 14 to 16 times. Typical people. But if you say I forgot, but more important, you have to first measure the first time when you get up, like. 6 o'clock, woke up, I take a look, see what is my blood sugar. A lot of times it's very interesting. Once you wake up, your blood sugar is only, could be 100, but then suddenly within an hour, haven't even eaten yet, it go up to 120. That's possible. The reason, and you elaborately the reason is your bodies are waiting for you to fight. So the body will automatically make some sugar for you, even you have not ate. For you to be for war before the body, I say war, the reason before you work. Okay, so that's why Abbott Libby is very interesting, very good. When I wake up, I wake up at 6 o'clock. I take my blood sugar. 7 o'clock before I eat, I measure, it might have 10% up already. And then when I eat, it will go further up to 8, 9, which is about 140, 160, somewhere around there. So it really changed. So each day you should have at least 14 to 16 times. But very important, always measure 2 hours after your meal and also before meal. So that way, and also before you go to sleep, you know where the blood sugar is. That will able to give you a whole line understanding. Now, certainly when you download Abbott Libby, it gives you the whole day reading. It's so wonderful. Every 15 minutes, there's one reading there. So you download the Excel, it will give you the entire day of the measurement because they have a chip in there to kind of record everything. And they will calculate for you what is the average daily blood sugar. And then also is very good is they also give you additional information like A1C. And so that would be really good. And it will help you to give you the A1C result. And that would be so wonderful. So anyway, this is the kind of Abbott Libby will help you tremendously. And secondly, how do I know what weight should be? Now, you need to look up BMI, because right now it's difficult to talk about BMI. If you look at BMI, they will teach you your weight and your calculation to calculate a BMI. So you could able to get your BMI. Your BMI should be lower than 25. Your BMI should be lower than 25. Women should be under 24. So you should use that as a gauge to understand what weight you should be in. My weight supposed to be at 180, then I will be good. So I still have 15 more pounds to go. Right now, 195. So with that, wow, I think my blood sugar will continue to lower. So that will be very good and healthy for you. So I hope that will give you all the information you folks ask. And if you have any more information, question, I'd love to answer. And I hope that you will, another question, what is red rice? There are brown rice and red rice. Red rice is just a rice. The skin is red and they actually haven't removed the fiber. But with that, the rice, because of this fiber skin in there, it increases the fiber. It helps you to digest much slower. With that, you eat, when you eat, because it's a lot of fiber, so it doesn't get the sugar out so fast, absorb your bloodstream. So you can feel yourself, but on the hand, you feel full, and by the hand, your blood sugar doesn't go up. So brown and red rice can be very good. And it's the rice came from Thailand, China, and I don't know, in US they have this product. But if not, brown rice is also very good. So try brown rice would be good. So let's see, any other question? Okay. I think I answered all my questions. And so if you have any question, feel free to drop me off an email. And I will write down my email here. My email is andydlau@gmail.com. And feel free to ask, and would love to get you more information. And really very good to you spend your weekend, 1 hour investment, help you a lot. I hope the webinar will help you to understand better about total diabetic management and keep healthy. 多謝各位堂友，好高興有機會同你再分享講全個所謂嘅糖尿病嘅管理。我希望各位係繼續努力降低血糖。Thank you again for spending time with me, and I hope that they will continue to help you to lower your blood sugar. And aloha. Thank you very much again. Thank you for all the people from Hawaii, Philippines, Hawaii, Singapore, California. Thank you again. Goodbye.